I'm Sharon Ward-Fore. I'm the Infection Prevention Advisor for Metrex. Happy International Infection Prevention Week, everyone. Thank you for all you do to keep patients, visitors, and staff safe. The theme for International IP Week is celebrating the fundamentals of infection prevention. With that in mind, I'd like to talk about how to use a disinfectant wipe. Now, healthcare-associated infections caused by the transfer of pathogens on environmental surfaces and medical devices are responsible for significant patient morbidity, mortality, and economic cost. Using disinfectant wipes is one of the most effective, efficient, and common methods for decontamination of environmental surfaces and non-critical medical devices in healthcare. Disinfectant wipes play a key role in preventing cross-contamination and possible infection. So one of the things we'll talk about is how do you use a disinfectant wipe? And there's two kinds of wipes. There's one-step wipes and two-step wipes. Now, certain disinfectant wipes are formulated with surfactants and detergents that help clean surfaces while that disinfection process is performed at the same time. These are called one-step cleaner disinfectants. Disinfectant wipes not specifically formulated as cleaner disinfectants should not be used as cleaners unless the label indicates the product is suitable for such use. Instead, they should be used in a two-step process that's described as wipe, discard, wipe. So how are we supposed to use one-step and two-step? Well, the way to use a one-step disinfectant wipe is if no visible soil is present, you would clean and disinfect following the manufacturer's instructions for use. You'll allow that treated surface to remain wet for the designated contact time of your product and let it air dry. Don't dry it. The way to use a two-step disinfectant wipe is you're going to take one wipe to pre-clean that surface, whether visible soil is present or not. You're going to discard that wipe. You're going to take a second wipe to disinfect that surface you just cleaned. And once you do that, this begins the disinfection timing. Now you're going to allow that treated surface to remain wet for the designated contact time. And again, let it air dry, don't dry it. Now the CDC requires thorough cleaning of blood and body fluid contaminated surfaces and other objects before application of any disinfectant. So even using a one-step cleaner disinfectant becomes a wipe, discard, wipe process, like a two-step disinfectant when the surface or equipment is visibly soiled. So some things to remember when you're using disinfectant wipes. So thanks everyone for listening. Have a wonderful International IP Week.